case of 3 years old boy. This particular child was brought to me with autistic developmental syndrome. Okay. The speech, he used to speak only word or two with 2 years, 8 months age. If he wants something, he'll point at that object. Very poor eye contact. He will not face you. He will look somewhere else and answer. He would love to see a rotating object. So if there is a fan, he would look at the fan. He loves rotating objects. So if there is any wheel which is going down, round and round, he will look at that fan. He will look, stand and stare it for hours. Childish behavior, understanding takes lot of time to understand. Has to be told repeatedly to follow the command. Once told, forgets again. Very curious. He has been started asking questions, repeating the same thing, and hyperactivity. So these are all symptoms of the syndrome. Behavior, very curious, repeats the same thing, hyperactivity, stares at rotating object. This is what we are revising so that we remember. Childish behavior, understanding takes time to understand, has to be told again. Socialization, doesn't mix with people, shy, doesn't like to stay in company. Communication, speaks only few words, one or two words. If he wants something, points it out. Eye contact poor. Past history, recurrent worm. Family history, grandfather, paternal grandfather has asthma, maternal grandmother has got hypertension. So no major history. Birth weight 3.5 kg, speech 2 year 8 months, walking 2 years. But the teething was in time, which was very, very important. By 9 months, the teething started. Other two were very, very delayed. The delivery was done by cesarean section as the labor pain was absent. Desire for spicy food, appetite good, thirst 7 to 8 glasses in a day, profuse perspiration, overall chilly, urine frequent at short intervals, sleep, teeth grinding, shows there are worms. More mental symptoms, childish behavior, wants attention, concentration span is little less. Attached to mother more. On examination, chest NAD, rough air, gum swollen, mild throat infection. So we take the totality, childish behavior, restlessness tendency, concentration difficult, weakness of memory, teeth grinding, desire spicy, urine frequent. And see, we have the repetization table. The remedies which could be considered was Baryta, Calcarea, and Sina. The patient was prescribed Baryta based on the totality and delayed development, and see the response. After 2 months, speech better, makes attempt to frame the sentence, behavior is better. The medicine is continued in the form of placebo. After 3 months, speech much better, attention span is increased, behavior is better. So we gave the patient placebo. See, just see this. When the right medicine with the right sensitivity of the patient meets, even Baryta 30, just few doses will do the job. 1712, speech much better, still doesn't socialize. Concentration is poor. Inquisitiveness, curiosity same. Repetitive behavior has started again. So why do we want to repeat? Two things. Still doesn't socialize and repetitive behavior has started. So that is why we give now Baryta repeatedly. Speaks many words. Itching in the rectum, teeth grinding, clinging to mother, behavior is better. But because of the itching in the rectum, okay, and teeth grinding, this suggests that there are worms in the body. 26.5, worms are better, grinding better, concentration better, speech better. Started initializing talks with the stranger. See the follow up, how the evolution improves the child and goes to the next level. Months passed by, we found lots of improvement in him. Concentration better, speech better, eye contact better, understanding better. Placebo. 28-2, next year, he had drastic improvement in the behavior, communication, and social skill. In between, he had some acute complaints like vomiting, cold, which was taken care, was better overall. The present condition, the child is completely normal, socializes more actively, likes to mix with people, talks to others, strangers. Repetitive behavior, repetitive sentence is much better. Eye contact is much better. Concentration is better. Child goes to school and performs normal activity. The child is in normal school. The child which was given up as autistic child today goes to a normal school. And then one of the biggest hospital of India, the test was done. Child showed rating scale, mild autism, and on screening for autism in toddlers and young, STAT shows no sign of autism. See the before and after response, completely recovered from the problem.